Building a better Bay Area means tracking the efforts of nonprofit organizations that are helping to solve problems. There are a number of organizations in San Francisco. They're doing important work, right, to keep drug users from dying on the streets. And many are distributing self-help kits that contain life-saving Narcan and clean needles, trying to reduce the transmission of diseases.
Yeah, but there are often other items inside those harm reduction kits, items critics argue enable bad behavior. ABC 7 News reporter Leanne Melendez joins us now with both sides of that argument, Leanne.
Well, you know, when it comes to the unhoused and drug users, the issues are always very complex. So here in San Francisco, one group is focused on one thing, which is keeping people alive. Period. Full stop. It ends there. There are others who believe that recovery, abstinence, is the only way to help a drug user get out of that situation. They disagree on many things, especially when it comes to harm reduction and the supplies that come with it, which, by the way, are allowed by California law.
This is aluminum foil. This is a lot of it.
What is it used for?
This is used so they can put their fentanyl on here, and then they burn it and they smoke it through a straw.
That's longtime Tenderloin resident J.J. Smith, who showed us what's inside this harm reduction kit, accessible to any drug user in the neighborhood, which includes straws and other drug paraphernalia.
The hypodermic needles and the syringes, I can understand you don't want to pass borne diseases with those items, but there's a lot of items in there that doesn't have anything to do with passing diseases. This tin can they give you to cook up drugs, which shouldn't have nothing to do with harm reduction, because you cannot catch any disease from off this can. So this is an enabling device right here.
But others argue that giving out straws and pipes keep drug users from sharing with one another, therefore preventing the spread of hepatitis C and other infections.
We're worried about people having cracked lips or blood at the source of the site of smoking. And by offering these supplies, we reduce the risk of folks transmitting between sharing supply.
It's part of San Francisco's public health strategy called harm reduction, taking steps to reduce the negative consequences of using drugs. We want to make it clear the San Francisco AIDS Foundation does not offer pipes as part of their harm reduction strategy, but some other organizations do. A few medical studies have found that hepatitis C can be passed among drug users by sharing their pipes, but only under certain circumstances.
That other person has to have open sores for blood to enter their bloodstream from this pipe. So in general, yes, I mean, clean and your own material is a good thing.
Advocates say harm reduction kits keep people healthy. Yet, as we have witnessed many times, some of those suffering from addiction are not always so particular about how and with whom they share their drugs. Los Angeles Council member Tracy Park came to San Francisco to meet with people affected by the drug crisis.
We see the same type of approaches being used in Los Angeles. It isn't working. It's making things worse. We have got to shift the focus to actual rehab and recovery so that we can treat the whole person and get them stabilized and on a path to recovery.
But as far as we can tell, there's no mention of getting people off drugs, not even brochures when handing out harm reduction supplies.
You got one of those things you can put the needles in?
Yeah, we do. We got these fancy boys here too. We got the last one.
Oh, what about the little black ones? Cause that's
you prefer the little one too. The pencil boxes, I call them.
Yeah.
Those are nice, right?
All right.
Do you need anything else?
No, that'll be all.
Okay.
Oh yeah, one more thing.
What's up?
What about y'all got any pamphlets on detox or treatment?
I don't have any pamphlets on that.
The thing they put the needles in. Gotcha. But you got any pamphlets if somebody wants rehab or something?
We don't have any paperwork.
Okay. All right. Thank you.
Right on. Take care.
Today.
Hi, how can we help you?
Yes, I was trying to see, do you have any type of information, like literature, anything of like where programs are at and what the programs are about?
You mean like rehab?
Yes.
Okay. I don't have anything that I can give you.
The San Francisco AIDS Foundation told us they offer a brochure on how to prevent overdoses when handing out Narcan.
We're in a really better era than we used to be for actual treatments for substance use. So I completely agree with the sentiment that anything that you give out to encourage safe use should also be giving material to reduce use and to seek treatment.
So just recently, Governor Newsom signed into law AB 663, a bill proposed by Assemblyman Matt Haney, which would allow for mobile pharmacies to travel to neighborhoods like the Tenderloin and South of Market that have been especially hit hard by the fentanyl epidemic. The mobile pharmacy would then dispense medication that treat opioid addiction, and this could be a game changer.
Right.
For many people.
But not having those pamphlets, is that a one-off or is that actually policy for them?
It's not. I mean, they say that they focus specifically on, keeping people healthy and alive. And other people say, well, they should also talk about treatment.
Yeah.
But they don't.
Yeah, it's a complicated situation and
Very.
somewhat confusing to know what direction to go in because it's kind of one or the other.
Right.
Right.
Well, like everything in the city.
Yeah.